Patients at 2 hospitals in the Washington, D.C. area are being tested for possible Ebola. One is at Howard University Hospital after traveling from Nigeria. The other is at a hospital in Rockville, Maryland. We asked Dr. Jon LaPook to show us what hospitals in this country are doing to prepare for Ebola.
In New York City emergency rooms, the writing is on the wall, asking patients to report flu-like symptoms that could suggest Ebola. In the ER at NYU Langone Medical Center, doctors frequently test protocols designed to identify infected patients.
This is the isolation room.
Dr. Jennifer Leiter-Fisher is part of the infection control team.
We have something called secret shoppers that we have.
What does that mean?
People in infection prevention will randomly show up to the emergency department pretending that they recently traveled to West Africa. The emergency department staff does not know that they're a fake patient, if you will.
So far, she says, the staff here has asked all the right questions. If Ebola is suspected in one of these test runs, the patient is given a mask and immediately brought to the isolation room. Members of the emergency room team are immediately notified.
The triage nurse makes a phone call to the back of the emergency department so that physicians and healthcare workers are aware.
That's unlike the hospital in Dallas, where a breakdown in electronic communication led to Thomas Eric Duncan being sent home. Dr. Fisher says, given the scope of the outbreak in West Africa, she expects to see Ebola patients in New York City.
The trick will be in several months from now to keep doing those mock runs to make sure that it's always on the forefront of people's minds, because I don't think Ebola is going away anytime soon.
John, we heard Dr. Fauci earlier say there's not going to be an outbreak in America. How can he be so sure?
Well, Scott, it's important to distinguish between an individual case of Ebola and an outbreak. And I do think it's important to emotionally immunize Americans against the near certainty that there will be individual cases. But given the robust healthcare system here, it's very likely that it'll be contained, but only if protocol is followed, something that was not done in Dallas.
You know, we're approaching flu season. I can imagine people will start getting symptoms and they'll jump to the wrong conclusions.
Right. Even without a travel history to West Africa, there's still going to be some panic and thinking, well, maybe they somehow were exposed. And if there ever was a time to get the flu shot to protect you against getting the flu, it won't protect you against getting Ebola, but against getting the flu and getting the confusion associated with that, it's now.
Dr. Jon LaPook, thank you very much. Dr. LaPook is answering questions about Ebola on our Facebook page. It's at facebook.com/CBS Evening News.